Thank you for tuning in. If you have watched my introduction video, you know a little bit about STOMP LD and why we're making these videos. But I'd like to find out more, so Gaynor, a consultant nurse, is going to tell you how doctors can manage STOMP LD.
Thanks, Daniel. I've been involved in a group in my area helping to think about what we need to do about stopping over-medicating people with learning disabilities.
Does that mean that all people with learning disabilities are given too much medicine?
This is just about types of medicines called psychotropics, often started by a psychiatrist and then sometimes passed to the GP to monitor and review. Sometimes GPs or nurses that can prescribe start people on the medicines.
So what can doctors do?
Well, for a start, doctors can identify which patients on their learning disability register are taking psychotropic medicines. Pharmacy teams are helping to do this. They are also checking how long patients have been taking the medicine and who started the prescribing. Doctors are inviting patients in for a full review if they haven't already been seen by a psychiatrist.
You said a full review. What does that mean?
For each patient, it will be different. Some patients with learning disabilities will have difficulty communicating, so this means doctors will need the help of carers and family. Where doctors can, they should link the medication review to their yearly health check. This means a longer appointment, so doctors must make sure receptionists know to book this in. The doctor will need to find out when and why each drug was started. They want to know what the medicine was supposed to be helping with. The doctor might ask carers and the patient to fill in charts about behaviour or a workbook that helps to check on how well the medicine is working or for side effects. They will talk to the patient and their carers about the risks and benefits of the medicines. The doctor will come up with a plan that could include reducing or slowly stopping the medicine. It might be that they change to a different type of medicine. This would be done one medicine at a time. They will ask a lot of questions. The Royal College of Psychiatrists has a guide to help, and this can be found at the website shown.
So will everyone with a learning disability have to stop taking this kind of medicine?
For some people, it will be the right medicine and they'll continue to take it. However, doctors will keep checking that it is right. No one should stop taking their medicines unless they have spoken to their prescriber.
What would happen if the carer thought that someone should stay on the medicine, but you think it needs to be changed?
Doctors, Daniel, can't give medicines or other treatments to people that do not need them. This would be harmful and they aren't allowed to do this. What they would do is talk to the carer about why the medicines aren't appropriate and try and work out why they are reluctant to change. This might be about a fear of the behaviours returning again. Doctors can ask for extra help from the NHS Community Learning Disability Service for some people.
Will family doctors review everyone then?
Doctors will probably refer some patients to the learning disability psychiatrist. They can always ring for advice anyway. If doctors try and reduce the medicine and the patient has severe behavioural problems, they will definitely need to refer to the psychiatrist. There are some guidance that doctors can use from the website shown.
Thank you, Gaynor. Is there anything that you would like to add for other GPs?
This may seem a big task to start with, but it is actually good practice and benefits your patients. You will find that your surgery will only have a few patients that this applies to. There is help out there. Talk to your local NHS Learning Disability Service and the CCG Pharmacy Lead.
Thank you, Gaynor. So that is the end of the GP video, but before you go, I'll summarise the main advice. Follow the psychotropic medication guidance from the Royal College of Psychiatrists. Use easy-read medication leaflets available from the website shown. Find out what signs and symptoms the medication was prescribed for and if it has made a difference. Use resources already available for monitoring behaviour and side effects. Here are some useful resources.